Hey everyone, happy International Women's Day. And today, I just want to inform, my audience. I thank you every time for your attention, tuning into this station. And just think about it that, as we are celebrating International Women's Day, yeah, that, it's something that just came to my mind. I've been impacting my community, people, in my practice, mentoring, and creating awareness, mental health education, overall wellness, overall well-being. And I think I can still do more, especially at this season that we are celebrating, the impact of women in our community, in our society, in our nations. So I said, oh, it will not be a bad thing, to add to my roles, to my responsibility. Yeah, to be a blessing to people around me, far and beyond, to add to my roles and my responsibility. With many decades, like over 3 decades in healthcare, I've seen it all. And I think it will be a good thing to bring that knowledge, that experience, that expertise to the younger generation, to the next generation of healthcare professionals. And that is what I'm starting right from the word go. And if you are new here, my name is Dr. Debbie. I'm a wellness coach. I'm a doctoral prepared psychiatric nurse practitioner. I have my own practice where I see patients, I see children, yeah, from age 6 to teenagers, adolescents, young adults, and adults till age 60. So, and I do mental health education as well. I do that online, to benefit people, for people to take care of their health. And I just think that, okay, there are, because lately so many professionals, they've been reaching out to me, asking to be mentored and all that. And I think that, oh, I can do better. That's, instead of like a one-to-one, like a small group, I can also, help, to mentor the young generations in the health related discipline. And that is what I am planning to start from the word go. Actually, this yesterday I have some group of students that I reach out to. This week that we just started again, but I just want to extend, my plan, to the larger community, that I'm open to that, like one-on-one, on group, about healthcare. I've seen a lot, I've seen it all in out. I've been involved, over 3 decades in healthcare, talk about medical, surgical experiences before I finally focus, for some years now in mental health. And we can pass all those experience, what makes you to excel, how you are able to influence with empathy, with compassion, to your patient, to make you to, to be able, to help people at the time of their need, especially with health, that you can help, to bring transformation to the life of people. And that is what I am planning to do in recent times, and I'm sure it's going to be something, beautiful, like, because like during our own time, at times you don't have like a mentor. You continue to just do struggle to find your way. We didn't have, like, at that time, maybe like internet, to get guidelines, to get up to date articles, studies, research. We get that, but it's really difficult to come across that. But despite it, all the odds and all the challenges, we were able to, scale through, and we were still able to blend up, to catch up and blend, with the new generation, with technology, with advancement. And not only just in one setting, but in many countries of the world. Yeah, like, now, I'm based, my practice is is based in the United States. I started from Africa and other countries in Africa just to see, like within West Africa, like Ghana, I register with their board of nursing, because I like to see what is going on. Even while I was in my country, in Nigeria, while I was already out of Nigeria, I went back, during my bachelor degree outside Nigeria, to volunteer in teaching hospitals and to be able to teach and impact and, influence the healthcare in major teaching hospitals in Nigeria that I volunteer. Like we talk about Luth, we talk about LASU, and went through different departments and just to see, compare with what is happening in other nations of the world and the areas that, I volunteer to be able to share with them my experience in other advanced world. Also in the Middle East, in Dubai, yeah, and I was already an American registered nurse then. I earned good money though, but I was able to pass my experience as well, my knowledge, my skills into that. In fact, there's one um, very popular, one of the like the five-star hospital in Dubai that I work with, that I told I, impacted them and introduced to them like that reduced, their like the rate of glucose, in the hospital. And so just sharing experience like that, and I think it is an high time that I can share that experience with larger community so that people do not need to go through all the all the rigmarole, um all the all the pains and the struggles that we went through to make the profession, the practice easier, for the next generation. And that is my plan. And if that seems like what you're up to, you can reach out to me, you can DM, you can send email, and we will catch up from there. I appreciate you, being with me. Now, most of the time it's going to be wellness on the streets. The weather is nice, the weather is warm, and now we can move out. So most of the time it will be in my neighborhood, recording outside, and just I love to walk, as a form of exercise, take brisk walk, and do my filming as well. And as you know, my name is Dr. Debbie. I'm a wellness coach, but I'm a doctoral professor, psychiatric nurse practitioner, and I have my practice where I see my patients by telepsychiatry. Thank you so much for working with me on this health walk today, on this journey, and on this like kind of online launching of my mentoring role that I'm mentoring role that I'm adding to a couple of things I've been doing before. And I hope we all enjoy it together, sharing our experiences, our knowledge, our skills, especially to people of color like me. It is not an easy thing, to be able to navigate the healthcare system in the West. Yeah, I know it's a tough one, but I'm telling you, it is possible, it is doable. And that is what we'll be sharing together. Thank you so much for for being with me on this journey. We'll be talking about, and healthcare is very wide, healthcare is broad, so many areas, that you can excel in, whether it is in medical, surgical, ICU, mental health, in the Navy, in the military, in pediatrics, in the operating theater, in the labor and delivery. It's limitless. The benefit is endless. You can choose whichever one, whether you want to be like long shift, short shift, per diem, that is as necessary. You want to be working once a day. You don't even want to see anyone. You want to be dealing just with papers, with statistics, informatics, research, hospice, so many areas, that you can focus on, you can specialize on, whatsoever is your interest. and there will always be a spot. There will always be a portion for you in healthcare. All right. I hope you enjoy, my introduction of my new role, being a mentor to young professionals in healthcare related. All right. Thank you so much. And I'll see you on my next video. Thank you. Bye.